Aloha, this is Dr. Aliza Kim, and you're watching Everyday Wellness. We're here joined by Dr. Kristen Coles again, and thank you so much for coming on the show.
Thank you.
Great. She's a naturopathic physician, and one of the things we're going to be talking about today is on treating the common ailments in childhood. So let's start with what may be the problems for some of these children with all these different sicknesses, some small, some big, and some, more acute, but they're in, big illnesses, and then there are the chronic ones that come on, one after another.
Well, the beautiful thing about children is that they haven't had that many years on this planet to become as sick sometimes as adults, but they still can get quite sick. And when that happens, maybe they're 5 years old, we don't have that many years to have to sift through to find out what were the inciting causes for this kid's sickness. We have the perinatal period when they're inside the uterus, and that can certainly create conditions for disease development later on. Then we have the early years. We have the question: were they breastfed? Were they formula fed? What were the details surrounding their first year and their nutrition at that point? And then we get into the sort of other things. And the biggest thing that we often keep coming back to with kids, and you'll see as we go through, is really what's going on with their diet, because diet is one of the biggest variables, we'll call it, for kid A versus kid B. The diet piece is the variable for most kids in a happy, healthy home.
Okay, great. Well, some of the what dietary things are you talking about as far as those variables goes?
So certainly we can go down to the basics. How much sugar are they doing? How many vegetables are they doing? What is their diet consisting of? Is it mainly processed foods? Is it mainly just, cereals and, chicken tenders and ketchup? Is ketchup their only vegetable? Those are the questions that I'm really going to dig into, because these early years, these formative years, they are really setting the foundation for the health of the individual for the rest of their life. And we even know that the maternal health is impacting the unborn, even the unconceived child's future health. We know that it is that important. This is a very critical time period to make sure that the nutrition, the vitamin, the minerals, all of these components are very, health-based, so that we can prevent diseases down the road.
Well, yet, we talk about this, how important this is for the diet is for their children, for our children, but we go out to, for example, restaurants. The keiki menus or the kid menus, they tend to be pretty much things like quesadillas or chicken tenders or
French fries, fried
pizza.
food.
Yeah, exactly. And I never feel like, and also they're lower quality. Even if they have a fillet on there, it's lower quality than what they would give to a regular person.
Yeah.
And I have a really big problem with it.
I have a problem with that too. And there's this funny belief, I feel it's a kind of pervasive belief, that for some reason kids just won't like vegetables. It's this belief. Who started this is what I want to know. Because if you believe that, then that's what you're going to enact with your kids. You're not going to offer them the vegetables. You're not going to make vegetables a main meal for them. It's an assumption. Kids don't like vegetables. Kids don't like green things. I'll tell you that's not true. You start a kid from, early age eating the diet you're doing, which should be, 60% vegetables, a little bit of fruit, some lean protein. That should be, an ideal diet for most people 80% of the time. If your kid is going to eat what you eat, they will learn that that's what food is. Kids don't have to learn that food is pizza.
Exactly. Yeah. And a lot of times that makes them more adventurous too, you know, so they are willing to try different types of foods, and you just have to continue trying. You know, I always, you know, I never believed this until I had a child, but they do have, you know, periods where they go through some of the things. Sometimes they will eat what they normally would, you know, what they're given. And then they'll go through a period where they don't want to eat anything that you give them, and all they want is, you know, something that's probably not as healthy for them, type of thing. But you know, what's really amazing is that foundational diet that you have set for them, they'll always come back to it. And with different types of cooking, you can hide a lot of different things in there. And they may think that this is like the greatest meal ever. So I think, well, let's start off with, you know, ear infections. This is one of the most common things I see in my office, and I'm sure in yours too, and with children. And what do you think may be the cause of these ear infections, and what can we do to maybe treat this naturally?
By the time someone walks into my office, their child has most likely had not just one, but a string of chronic otitis media ear infections. And by the time they're in my office, they're fed up with round after round of antibiotic. And they have parents have reached some level of, you know, why does my kid have to be on antibiotics over and over and over again? You know, the first couple, they'll take the antibiotic. You get to the 4th, you get to the 5th, you get to, you know, sometimes the 10th ear infection. And it really becomes a question, you know, what's going on with this kid? And there are certainly some anatomical differences between a child's ear canal and an adult's ear canal. They are shorter, they have a different angle, which makes it harder for them to clear their inner ear when it does get blocked up with mucus, which is often viral in nature. The thing about acute otitis media is that it's mainly viral. It's maybe 98% viral, 2% of the time it's bacterial, yet antibiotics are the #1 prescribed treatment for this, which may or may not be a good thing. I would argue it's not a good thing. When they reach my office and they've had a string of these ear infections, or even if it's their first one, you know, we want to look at a couple things. We always want to inspect the ear canal itself. You know, make sure that it is a simple, you know, otitis media infection. There's no perforations in the membrane. Some of the therapies that I'll utilize involve topical applications. However, if there's any perforation in the tympanic membrane, that is an absolute contraindication. So we always have to examine the ear itself, make sure that that's what's going on. And after that point, you know, we really dive into what's causing this. And with ear infections, it's a mucus buildup. There is the anatomical difference, and I'm sure, you know, as a chiropractor, a lot of times we will, you know, we'll want to look at C1, C2 junction. Maybe there's, you know, some stagnation here that we can help, you know, move the ear canal, move the neck. That's always a great thing. And then I will delve into their diet. That's going to be, you know, my next question down the line is what's the kid eating? Tell me about the diet. And there is a huge connection between dietary dairy intake and development of ear infections. I see it 8 to 9 times out of 10. Dairy will be a big trigger. And I don't necessarily even have to test them if they're young for this dairy. I will just tell the parents, take the kid off dairy for at least 3 weeks. And if they respond in a certain way, a favorable way, we are going to take them off dairy for a certain amount of time and see what happens to their health, to their mucus buildup, to their number of ear infections, and we'll go from there.
Great, fantastic. Well, then the question comes in, you know, what about calcium? Where do I get, you know, where do my children get calcium from?
That's the exact next question I'll get, usually from, you know, dad, is, well, you know, the kid's not going to get calcium. He has to have calcium, you know. I want him to be a basketball star, and he needs his bones and strong bones. And, and I say, I understand. And what you might not be familiar with is that there are a lot of other foods besides dairy that do have bioavailable calcium. Now, I will furnish them with a long list of different foods and the amount of calcium in them, and we'll go through and we'll pick and choose and put together a nice list for the parents of other types of foods that will have calcium in it.
Great.
Now, a kid 1 to 3 years old only needs about 700 milligrams of calcium a day for their recommended dietary allowance, their RDA. That's not that hard to piece together, even without dairy.
Right.
I think we have a list, actually, for the viewers that we can share that lists the amount of calcium in foods. And so if we look at that, we can see the different dairy foods are at the top there. And yeah, they are chock full of calcium. But if we, skip down and we look at something like spinach or collard greens, we're up in the mid 200s in terms of milligrams. And that's just for a cup of cooked greens. Now, they might say, my kid won't eat greens. And I say, okay. And then we, work on down the list here. There's, nuts, sesame paste, tahini, which is a common ingredient in hummus.
Right.
Look at that, 307 milligrams in just 2 tablespoons.
That's pretty incredible.
That's pretty good.
That's easy to do. I mean, it's definitely doable.
Right.
Right.
And then, you have some salmon, you have some sardines.
Right.
You have reached your limit.
Right.
And you've done a really good job at it as well.
Right.
Blackstrap molasses, I'll tell you, it's one of my favorite things to recommend. It has a good amount of calcium, 172 in just a tablespoon. It also is a rich source of iron, helps treat and prevent anemia, and I think kids can tolerate the taste of that for the most part.
How would you recommend maybe hiding that?
You could cook it up in, a little muffin.
Great.
Yep.
Yeah,
Carrot muffin.
They can do that. Okay. And one of the things I have found, the spinach, it's easy to hide in food because it doesn't have a whole lot of taste, but it just, when you cook it, it actually brings out, it's very mild in taste.
Yeah.
So, for children, it's definitely, and all you have to do is just cut them up because sometimes it's not about the taste, it's about the texture.
Yes.
And that's why, a lot of kids don't like that lingering feeling in their palate. And so if you chop them up really finely, more work for the mother, but it definitely, it's doable. They will eat that. One of my favorite things, my personal favorite, is bone broth. And this is one thing that I mentioned that people don't eat enough of. Yeah. And when I mention bone broth, people kind of look at me like, is that the one that comes in a container? Those different types of broth? And I said, no, you can use that too, but that's not really a true bone broth because it's processed food. But you can make this at home, and one of the beautiful thing about this is that you can make it and freeze it. And so what I normally would do is I would make a whole batch of it, and I'll make it without any vegetables because I know a lot of the recipes bring in different vegetables to cook with, with the broth, but I do it just with pure broth. And then I will go ahead and put them in glass containers and then freeze them. One of the things that my patients have noticed, because over the weekend I actually fractured my fingers, working out at a gym, and that's the first thing I did is on top of taking all my whole foods supplements, I made the whole chicken broth, and all you have to do is get a real, organic chicken, those just raw ones, and then you just cook it for about a couple hours, and then you can mix it with just different vegetables, and especially with garlic, it just makes it taste so wonderful.
Yeah. It's an amazing source of calcium. Where does most of the calcium in our bodies get utilized? Our bones. So, even beef marrow bones,
yes,
incredible. The marrow itself has a huge amount of nutrients. It's nutrient rich, nutrient dense, and then that calcium that has, been built up in those bones, you're going to get that as you cook and cook and cook those bones down. Incredibly nutritious.
Yeah, absolutely. And we have that bone broth recipe, as a matter of fact, that the viewers can view. And this. As far as the whole bone marrow, the oxtail, the short ribs, they need to be cooked a little longer, 24 to 72 hours, and you want to put them in very, very low heat. So if you have a slow cooker, this is great because you can pretty much prepare it and forget about it. And another thing that I do with bone broth is not only making soups with it, but I also would use them to make risotto, and that brings in, because it requires for you to use some kind of broth anyhow, but these bone broth are fantastic in risottos and just mix in chop up a whole bunch of vegetables and different things in it, and voila, you have your dinner.
Yep.
And children love that.
Yep.
So it's just something that's wonderful that you could incorporate easily into your daily calcium content. Okay, great. Well, can you tell us a little bit about the sinus infections and the runny nose that a lot of times the children will get?
Oh yes, the sinus infections, but more so that a runny nose, that chronic runny nose from like November to April.
Right.
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 That's a lot of mucus production.
Yes. Yes.
So there is a process going on that's stimulating this mucus production. Now, we will want to look through that. Is it environmental allergy related or is it immune related? Is it sort of a underlying smoldering virus that the kid isn't kicking? Is it from something in the diet that's creating mucus? Again, I'm going to look at dairy.
Right.
Dairy, when we talk about mucus producing foods, dairy is a huge one. Bananas are also a very big mucus producing food, and a lot of kids are eating a lot of bananas.
Yes. Yeah.
So one of the things, if we want to reduce mucus, I'll give them a list of foods that are high mucus promoting foods. And then if I really feel like they're having an immune trigger to a food in their diet, like dairy, there'll be some other small hints. There'll be dark circles, the black shiners under the eyes. These are called allergic shiners. When I see those in a young child, it is a very clear sign to me that I definitely need to investigate their diet and investigate if there are foods in it that are producing some type of immune reaction.
Yeah, and another thing is when they breathe through their mouth, because obviously their sinus is all congested and they can't breathe properly. Then they snore at night.
They're snoring. They're getting less oxygen.
Right.
They're they're going to be a little tired during the day. Absolutely.
I mean, it retards their growth as well too, and I've seen that happen when that is chronic for them. So definitely, as far as I also another thing about the sinus infections or even cough, chronic cough type of thing, I always tend to go to the digestion because that is the place where the phlegm can be produced, and so I would like to kind of talk about the digestion part of it and the constipation issues that a lot of children have.
Yeah, the digestive tract is a very key organ system for the young child. And what's very interesting is that our digestive tracts get populated with bacteria in a normal fashion, and that population occurs when they exit the birth canal. A vaginal delivery will populate the child, it will inoculate them. Nose, mouth, everything gets inoculated by the normal vaginal flora, and that is known to be sort of a critical process in the development of a normal, healthy digestive system. Now, C-section rates are on the rise.
Yes.
They are being pushed, they are being promoted, and many women are going the C-section route. And I do clearly see links between the young pediatric patients that I see with digestive complaints and C-section birth.
Interesting.
Now, C-section birth, it's sometimes a very necessary thing. It's sometimes unavoidable. I understand that. I'm not against cesarean section birth. I do think that there are some things we need to really jump in on after a cesarean birth to help that inoculation occur. Because that is going to really help